So in this video, we're going to be discussing the similarities between an osteopath and a chiropractor. Osteopaths and chiropractors often will work with your entire body rather than just the area of pain or concern. Both osteopathy and chiropractic are concerned with addressing you as the whole person. They take a holistic view of you rather than just treating symptoms. Both chiropractors and osteopaths use approaches that involve taking the spine out of its range of motion. This sometimes creates a crack or a release of the joint, which is just gas or carbon dioxide being released. And they will often, as part of their care plan, come up with individualized exercise prescription for you, lifestyle modifications, because they see you as an equal partner in healing and recovery rather than just a passive participant. The next question is an osteopath more qualified than a chiropractor? The answer is no. Both osteopaths and chiropractors take around 4 or 5 years to get their degree, and they're both qualified to the same standard of clinical care that's evidence informed. Both osteos and chiros are required to partake in at least 20 to 30 hours of development each year professionally to make sure they specialize their skills and broaden them. So is an osteopath or chiropractor better? No, there is no comparative studies to suggest an osteopath or a chiropractic is better than one or the other. It really does depend on your individual preference and your choice. But both methods have been proven to be effective in treating a wide variety of illnesses and symptoms, and so it's really down to you, the individual, and whether you feel one is a better fit for you over one another. So the best thing to do is to try both, see what you prefer. Clients can often find relief, long-term correction, particularly if you're suffering with conditions like migraines and headaches, carpal tunnel syndrome, frozen shoulder, sciatica, herniated discs, neck pain, lower back pain, sporting injuries, pelvic girdle pain, with some osteos and chiropractors actually having a special interest in pregnancy as well as pediatrics, so taking care of your babies if you have them. The next question is osteopathic manipulation versus chiropractic adjustment. Well, osteopathic manipulation is moving your joints and muscles using stretching and resistance and gentle pressure. The cares focus on long lever manipulations to the problem area based on what they felt from your exam. Chiropractors are going to use a specific adjustment to your spine in the presence of a vertebral subluxation, which is a misalignment of your spine, putting pressure on the nerves. They're going to assess that from your exam, any tests they did, structural tests or any x-ray analysis they did. So not everything usually needs to move. Some areas are actually moving too much when it comes to motion. But both professions are going to use some techniques that are more gentle than others and more high speed but low force depending on what you need. One thing I would say is that in osteopathy and chiropractic, stretching is often seen as one of the many tools to be used to help you function better. However, the skill in the assessment, analysis and the actual manipulation or adjustment is actually very different depending on who you see, whether it's just seen as like another tool in the toolbox or like a differentiator between one practitioner and another. To give you an analogy, you can tell in a basketball game, the one that's shooting free throws, that's done 200-300 free throws before the game, they're going to be consistent compared to someone that just does a free throw every now and then. It's the same with an adjustment. It's going to be different. You're going to experience a different feeling with someone that sees it not just as a tool but as a differentiator. So that is the similarities between a chiropractor and osteopath. In the next video, I'm going to be going through the cost of an osteopath versus a chiropractor, and I'm going to be discussing what that looks like from an investment, regardless of whether you see a chiropractor or an osteopath. And then I'm also going to leave a link below in the next video of factors and considerations of really what influences the price of those. So stay tuned and I'll see you soon.